Hello, how are you doing? Lovely to be here with you. My name is Andy Smith. I'm a functional breath instructor, and I've been working with your teachers on all the content of all the learning that you've been doing around breathing. So I decided I'll do this wee video to help with the breathing exercise for this week. And that exercise is called balloon breathing. All right. Now, it's called balloon breathing because we're going to focus on the bottom parts of your ribs and your lower parts of your lungs expanding and contracting as you breathe in and you breathe out. Okay. And we want to do this for a number of different reasons. We want to draw the air deeper into the bottom parts of the lungs. They're bigger. There's more wee sacs of air. They're called alveoli that we want to get as much air to as possible, and that lets more oxygen pass into the blood. And also, it helps you feel more calm and relaxed because it stimulates what's known as the vagus nerve, which you should have learned about in a previous lesson. So, what I'm going to do in a second, I'm going to bring a video up on the screen, and that's going to play and it's a wee circle, and it's going to go around, and it'll tell you when to breathe in, and I'll tell you when to breathe out. Now, we're going to breathe in a very, very slow breathing pattern. We're going to breathe at 6 breaths a minute. Okay, and the average for an adult in the UK now is somewhere between 14 and 18 breaths a minute. For children, it's maybe a wee bit higher sometimes. But we're looking to really slow the breath down, and through that slowing the breath, you're going to really calm down. You're going to feel nice and relaxed. So we'll do that for the first time. The second time, what we're going to do it for 2 minutes. Then we're going to have a minute's rest. We're going to do it for another 2 minutes, and we're going to lighten the breath. And then we're also going to make sure we're having that expansion contraction in the lower ribs, and we're going to make sure you're slowing the breath down as well. Okay, is everyone ready? Okay, I'll just get this set up now and bring it up on screen for you. Here we go. So we're going to get going now. Okay, so just follow the instructions on the screen. Here we go. All right, and then breathe out. Excellent. So we'll just take a couple of breaths just to get you used to this really slow breathing. So you're going to be breathing in for 5 seconds, and you're going to be breathing out for 5 seconds. All right. You just want to take the breath nice and slow. You just want to be nice and calm with your breathing. So you can breathe in for 5 seconds and then breathe out for 5 seconds. Okay. I want you to put your hands on your lower ribs. So if you see with me here, I've got my hands on my lower ribs. Right, and as I breathe in, sorry, as I breathe out, my ribs should come in and shrink. And as I breathe out, they should expand and get bigger and bigger. Breathing out like a balloon. And then breathing out, sorry. I'm going to breathe in, expand, and breathe out, squeeze back in. Okay, so breathe in, feel those lower ribs expanding, and then just bring a natural relaxation. Just almost let the air pass out. Don't push the air out when you're breathing out. Just let it happen naturally. In, expanding, and then let go and feel the ribs contracting. And then push the air out. Just relax and contract. In and breathe out. Breathe in and breathe out. Last one. Okay. And we'll finish bottom of the exhale. There we go. Okay, guys. So how did that feel? How did that feel for you guys? Do you feel a bit more calm? Do you feel a bit more relaxed? Well, hopefully you do. So again, with these deep, longer breaths, we're using the diaphragm, and because the diaphragm's moving down, so the diaphragm normally sits like this, and as it drops down like that, then that creates a wee bit of pressure in your chest, and that puffs your ribs out the ways, and that helps you take a deeper breath and get the air deeper into the bottom parts of the lungs, which is what we want. All right, so this time we're going to do the same breathing rhythm, and we're going to add lightening the breath as well. Okay, so see what you can do, see if it becomes easy, see if it's difficult, and the way you feel about it is the way you feel about it, and that's fine. Okay, so we just get back into it then, will we? So we're going to go for another couple of minutes, and then we're all done. Okay. So again, I guess the bottom there. So breathe in and breathe out. Get your hands on your lower ribs again and breathe in and breathe out. This might be tricky for some of you. That's okay. If you practice this enough, that breath, you just need to practice it. Little less air now, so nice. Just relax, let the air pass out. So just a little trickle of air coming in, just let the air pass out. Again, nice, nice and light breathing out. One more breaths, breathing in and finish. Brilliant. Well done, guys. Okay, so just bring your breathing back to normal. All right. And again, just think about how you feel. Just kind of go into your body and just see how you feel. Like, do you feel more calm and relaxed? Do you feel a bit more energized? Have you got a wee bit of a light head? So that would be more oxygen moving into the brain, and that might make you feel a wee bit lightheaded. Okay. So that's me done. All right. It's been lovely working with you. I think we're going to get a wee question and answer session sorted at some stage. And it'll be lovely to meet you all sometime soon. So speak to you soon. Bye bye.